Well, a new year and a new warning from the U.S. Surgeon General saying alcohol is the third leading preventable cause of cancer in America.
Yeah, CBS 17 investigative reporter Mary Smith is live for us tonight. And Mary, you spoke with a doctor from Duke University today about this advisory.
That's right. He says this advisory about the potential risks of cancer from consuming alcohol is long overdue. A newly released 22-page advisory from the United States Surgeon General outlines data on the relationship between alcohol consumption and cancer. It says alcohol use is a leading preventable cause of the disease behind obesity and tobacco use.
It's probably just another reason to maybe skip drinking.
I didn't know.
It would be great if people drink a little less, I would think.
The advisory says more than 70% of American adults say they had at least one drink a week in 2019 to 2020. But less than half of adults knew about the risk of alcohol consumption as it relates to cancer.
I think it's definitely long overdue for educating the public on the potential cancer risks of drinking alcohol, particularly in excess or beyond moderation.
Dr. Nicholas DeVito, who is an assistant professor of medicine at Duke and sees patients with gastrointestinal cancers, says health officials have known about this link for years.
This has been well known for decades, particularly when it relates to things like esophageal cancer. Some of the more, recent but better appreciated in large population studies include breast cancer and colorectal cancer.
The advisory also says nearly 97,000 cancer cases were connected to alcohol consumption in 2019, and in 2020, more than 740,000 worldwide cancer cases were connected to consuming alcohol. We asked Dr. DeVito if the old saying of a glass of wine a day being good for you is even true.
That's a really interesting question. I think that never really had the basis in fact that we wanted it to. It always certainly sounds good, but there are other confounding factors that can go into that. And there are certainly some people who genetically just should not drink alcohol at all for various reasons.
The advisory also recommends updating warning labels on alcoholic beverages to mention the risk of cancer. Back to you.
Mary, before you go, what are the recommended limits for drinks if you are going to drink or consume alcohol?
Yeah, the U.S. dietary guidelines recommended limits mentioned in this advisory are 2 drinks for men and 1 for women. We're live in Raleigh. Mary Smith, CBS 17 News.
All right, Mary, thank you.